to run for the summer as a population that could pilot this.
Mhm.
And I did notice that you guys had an online pre-departure experience for the students. And so we're hoping that some of these materials could be embedded into that platform, since you already have a learning management platform like Canvas or something like that is kind of like the thought. I mean, we could collaborate on populating your LMS with various materials. So what we would do is develop a few modules to tack on to what you guys already have going on in your syllabus around intercultural learning virtually, just so that students are able to have the empathy that's required to engage with medium English speaking populations remotely, to build those relationships, because we are hoping that this virtual experience is just as dynamic and in terms of relationship building as it is in person. So we would want to have an intercultural focus embedded within some of the activities that we would do with you guys. And in terms of being able to reach your specific learning goals and outcomes, we would create a set of activities that could be done, prior to and then also during virtual dialogues. And so through videos and Zoom sections. So for example, we could tour the city, and I know you guys do like a windshield survey, so we could tour the city or have footage of that in different environments so they could still complete like your windshield survey. We could go on site outreaches and go to healthcare facilities, interview staff, and be able to have those videos available for your students as well. And then we could have a curriculum whereby students could watch these materials, come up with some guiding questions for a conversation, and then bring in key partners that have been identified for actual dialogues between the students as well. And then in terms of like the clinical hours, since it does need to be project-based, we were thinking that, for example, if they're doing an assessment through like a windshield type survey, or if they are, watching how medical practices are done in clinics and on community outreaches through analyzing these situations, they can still develop some health promotion materials or be able to kind of come up with some kind of intervention or activity that an organization is doing that they would want to support. And we can use the project fund model that we already have to be able to support that effort on the ground. So they would still kind of be able to be involved with whether it's like increasing hand washing outreaches or any other type of public health intervention that has been identified through this process. So the learning outcomes for this that I would see, just based on like your brief description that you guys have on your website about this program, would be acquiring a basic knowledge of Togo and Ghanaian culture, geography, language, healthcare, and the epidemiology of prevalent disease, which is obviously your expertise, the prevalent disease portion of it. But we would be able to provide those other aspects. Gaining practical understanding of how public health is conducted in Togo and in Ghana, especially in the face of COVID-19. And then gain awareness of the challenges facing those living in low and middle income countries through readings, videos, and different reflections. And additionally, the intercultural knowledge, competency skills that would be gained through a virtual learning environment. The time frame for this that is being proposed is, because of the limited mobility, we would be able to work together, hopefully, on a syllabus and like kind of have a joint curriculum put together within the months of April and May. And then in June, we would be confirming our partners and going out and getting those videos and getting those materials ready to populate into a learning platform in July. Hopefully, we could launch it in August, the same dates as the program were originally set to run. But if there are any glitches or issues, an alternative launch could be in the fall, maybe midway through their fall semester for 2 or 3 weeks, they could tack this on as like a lab or some other type of experience, or it could be launched as part of International Education Month. So those are things to discuss. And then the cost, since this is a new collaborative model, we've done some market research, we understand the market and what these types of programs are charging, but we would like to have this, be more of a collaboration. And so we would like to come up with a cost together that we think would be suitable for your students, given that this is a vast divergence from what they were typically expecting. So that's my overview and spiel.
Wow, that was really That's really great. A very fast turnaround on this too, Sean.
That's amazing.
Yeah, this is really well thought out, Sean. Um,
Can I ask, Val, you might be interested too. I think this might be an option for our APRN students who need some clinical hours. And I'm just wondering if we could consider adding some of our APRN students, even though they hadn't signed up for the trip. This is something they could do.
mhm.
It'd be
This
interesting.
is something they could do. Miriam, are you saying for their leadership hours, or are you thinking of having them help us develop this for their leadership hours?
Oh, well, that's a good idea too. We certainly could ask a leadership student to help us develop this.
Yeah.
But then as far as fulfilling either the APRN or leader clinical hours.
I concur. I think this is a
Carry
good, yeah. And Mary, what do you think? We could use this for clinical hours for community health students who
I
chose
was
to do
just
this.
wondering what your capacity was for student number online, because there's a lot of students that would have loved to go on this trip and just didn't have the financial resources. And I know, I'm sure Tina and Val are getting many more emails than I am, but I'm getting a lot of emails from students, especially the Ghana students that are so disappointed.
Mhm.
And this is going to be such a great thing to offer them.
Yeah.
And I think other students would be interested, because I get a lot of pressure for students, especially if you can launch it in August, because that 8th semester is so stressful.
Yeah.
If they could do it in August, it would be like a gift.
Yeah.
Okay.
And that's just what I was thinking too, Mary, because that is part of the huge draw for students is they're like, I get all my clinical hours done. And some of the emails that I have gotten from students are along those lines, where they're really disappointed that they can't go, and then they're really disappointed about the hours too. So I think that is such a consistent selling point for them,
Right.
that anything we could do to let them do it early would
In
be,
August.
yeah. I think I'm afraid if we can't launch it until the regular semester, that it's not going to be as appealing to
Okay.
some of them.
Right.
Yeah, I think.
Can I ask a couple more questions, please?
Yes. Mhm.
I think that what Tina and Mary are talking about, that students will want to complete this before the semester starts, is true. But there may also be another group that would want to complete this in a self-paced way. And so back to Mary's question, what is your total capacity? And would it be possible to let students complete it in early August, as we've traditionally done with the in-person program, or B, have it more self-paced over the course of the semester for those undergrad students, if they would prefer that for whatever reason?
Mhm.
You mean like either or, Val, or?
That's what I'm saying, Mary, because some kids can't go because they work or whatever, and
Mhm.
Yeah.
I think if it's a self-paced environment, what they might miss out on is like that interaction, like those actual dialogues with the community members, because we wouldn't be able to bring them in at any point throughout the semester. So if it's in August, at least we can guarantee those conversations. So they can still get the material, but they might not be able to have access to those dialogues.
Right, and Val, there's some other opportunities for some students that maybe can't do it in August in a concentrated way, because the whole rural health immersion program, I'm developing an online program. So there's other opportunities for them. And I also think that the students will get more out of it if they immerse themselves, just like they were going to do 2 weeks in Ghana. They're going to like do this immersion into 2 weeks. I mean, maybe that's not true, but I would think that they would really focus and get much more out of it than trying to rush through it, or
Yeah, and it's also the dialogue with you guys, and with Sean and Dom, and I think a lot of what happens in this course is that, you know, and a lot of their growth happens when they have they just learn a lot. So.
Yeah, we definitely want to make sure that we would have as many touch points with community members as possible within those 2 weeks. I think that's what makes this like appealing and rich. And not only, you know, the healthcare professionals, but having the young people come in and talk about pop culture and, you know, just to have like that well-rounded, you know, experience of understanding what it's like to live.
And the back and forth.
I think this offers some real potential for the future.
I do too.
If we have students who do go, we have students who always can't go because of cost or timing and what have you. So the next time we do this, we could tie them in and have our students there, you know, so we have an added cohort, which I think would be really exciting.
I agree, Miriam. It'll be great to take this forward and have it be more integrated.
It's really innovative, Sean.
Yeah, it is.
Thank you. I thought a lot about it. This was my brain project for the past 2 weeks.
Awesome. You know, when this is over, some of you brainiacs who submit things for publication, this would make a great publication about how we did innovative online international learning.
Yeah.
It's true. And it's also, at least for, you know, MU, part of, and I know Will know this better than anybody, you know, part of what MU really wants to do is expand global learning and study abroad opportunities for students. But cost is always a barrier, you know, and especially for the first gen students. And this is a way potentially, I think, to bring down the costs, but make it, you know, still accessible. So there's a lot to like here. I mean, just not paying the airfare.
Right, alone.
Right? Yeah. And then I assume, you know, the housing costs and stuff like that, that's not going to be as a factor.
And Dom and I were talking about it as well. And with this model, like with our project funding model that we do, we take a portion of the program fees to submit to part. We would actually be able to give them a greater percentage of that because we would have fewer other costs. And so then the cost to the actual projects would actually be more substantial.
Yeah.
So
and I think it would make it more clear to the students too that this is what they're supporting, you know, like.
Yeah,
that would be good, Tina, because they might ask, well, if we're not going, why do we pay anything? But I do think if you kind of say that, and I think they'll get that, but I think this is so exciting. I just can't believe you put this together in a couple of days.
Yeah.
The hard part is still yet to come because it's the collaboration piece and the working on the syllabus and getting that honed out with you guys. So who would we work with, and what do you see that looking like?
Well, I'm still the director of the program, and I'm sorry,
there's a garbage truck outside. I think
No, you're muted, Sean. Okay. So I'd be happy to continue to work with you on this, and I think it's a great thing.
Yay! Awesome.
So timeline-wise, we're talking about. We're talking about still trying to run this in the same time, and so still this year you want to run it at the same time, and the same sort of week. And
they've already blocked that time out, right? That would be perfect.
Yeah.
Okay. And so we would just I'll survey the students. We can communicate who's interested, and any more students that want to hop on.
Can I go back to
the capacity?
The question about the syllabus? I know that Tina is the director of the program, and I think that's a really important role, but I'll probably be supervising the undergraduate students for the rest of the semester and grading their work. And so I feel like I should also work on that syllabus with you, Sean, just because I'm more tied in with the course. than Tina is at this point.
And you know, I don't have any real role. I'm excited to be part of this call. And when I talked to William, I don't need to have significant input, but I'd love to be like in the loop. So, you know,
Yeah.
And I do all the clinical coordination with the course. So it'd be good
Right.
like to be.
Yeah, I think that's important that Mary, and do you want to also be part of this, Miriam? Because you're going to be teaching the students too.
Or our APRN students, yeah, I would like to
Yeah.
have activities that would be relevant.
Yeah.
Yeah, so I think it's important that we all really collaborate up front rather than just one of us collaborating.
Well,
I know that takes a little bit longer,
yeah,
and can be a little bit more cumbersome, but I think at the end of the day, then everybody's bought in to whatever we go forward with.
yeah. I want to be clear. I wasn't just saying,
Oh, I know.
I want to do it myself. Like,
Oh,
You know, the other thing
You were
is
taking the front line for us. You were taking the front line. But
she's a leader, but it might take some work off her if we say, oh, I found this great resource, or, you know, I can get the Canvas course, whatever. I think if it falls on one person, it'll be a lot in light of what else we're all doing.
yeah. No, and I appreciate you being willing to be involved because of your experience and expertise in study abroad, Tina.
thank you.
And so we'll get, so you all will work on the details of it, get it all ironed out. I'll notify the students, start rallying the students that were in the original cohort and see if
Yeah.
they'd be interested in something like this.
Good deal.
And correct me if there's any input you have. And then as you create a Canvas course, maybe within that Canvas course, we can embed orientations, you know, and sort of a timeline so the students know how we're going to kind of prepare them. One of the things we have a little more flexibility here with is, you know, how we get together and meet for orientations. Usually we're rushed to do one, and then they're rushing to do their finals and get out the door. This might be a good chance to maybe connect with them a few times as we prepare them. And Sean, you know, if you want to be involved in any of that preparation work and how we orient students, because for us, we do have an online orientation, but that's a general study abroad orientation. That's not the sort of country specific one that we do
Okay.
from Ghana. And
Yeah.
so we might want to break that up into either a couple videos or just a couple meetings. But as Tina, you might want to let me know too what you want that to kind of look like, or any ideas anyone has, if you want to meet together. But I can help schedule all that. But the first thing is we'll have to figure out, because we haven't done anything like this in the International Center yet. We're thrilled to do this, but we'll have to make sure, yeah, we got all our ducks in a row and we're ready to support those students for this journey. So we can.
So you'll offer it to the already enrolled students first, and then maybe you can just look at things and see what your capacity is. I mean, could we take 10 more students, or would that overburden, you know, you or the system, or 5 more, you know? Before we throw it out there, we'll see if all the previously registered students are still interested. I'd be surprised if they would not be, but.
Yeah.
I think my guess is
another key issue is going to be the cost.
The cost, yeah, that's what I wanted to, I guess that's what we can like discuss talk through together. So the field, I'm sure you've seen a lot of people offering virtual internships, you know, and things like that. And the market research, the cost can be anywhere from almost as expensive as going abroad to very minimal. And so a medium cost that we would be comfortable would be $12.95 per participant. And so we would just want to talk through that and see what your thoughts are about that cost. That would allow us to, you know, be able to have a nice set of funds available for our partners as well as sustain, you know, the program. So that was our initial thought for cost.
Yeah. So the benefit of the program fees is that they can put it on their, you know, scholarships, their student loans, what have you, as compared to everything else that they pay, like the airfare and stuff. So that makes it easier to sell for them. I think that there's probably a couple factors that might go into communicating this to them. One is, you know, compared to the original cost, right? This is a significant.
What do you think the average is, Tina? I mean, what do you think the cost to this program is?
Well, I mean, the program costs when they're on the ground is quite a bit more, and then and I don't know exactly what it came down to this year, but Sean,
I think the students on average, Mary, spend about 6,000.
Gotcha.
Yeah. It's about 4,000 for Costa Rica, but it's more for Ghana, and the cost is almost all airfare.
Airfare, right.
Yeah. Would you agree, William?
Yeah, I was gonna pull it up here. So we could, well, something's wrong with our website, but yeah, it's around 6,000, and you know,
Yeah.
I think the program cost, Sean, that you usually is what,
2220.
2220. And so this is, you know, 1,000 less than that. And when we don't have housing, transportation, visas, you know, the faculty expenses, you know, all that, the International Center is not going to charge for a lot of things. I think it's only a couple $100 that we might add to that. So I think it would just be that $1,295 plus maybe $200 for the students. I think that's it. As long as they've got the ability to, you know, work remotely.
Yeah.
For each student in whatever capacity that looks like, that you'll need them to have. Yeah.
So I think explaining to them what the costs are, you know, and why and because effectively one of the reasons this appealed to me is that not only is this an experience for them, and they are able to, you know, not have to deal with the clinical hours this summer, but the most important thing is that they are supporting the community, you know, and that they're doing, because a lot of them, another motivation that they really talk about is they want to do something meaningful and helpful. So, you know, and sometimes that spills over. They think they're going to go to Africa and save people. They come back with a more nuanced understanding of it, but that is clearly a big motivation for them. So I think helping them to understand, you know, that piece of it is going to be big.
Yeah, that'd be key. And then, yeah, that aspect, and then as well as what that looks like, sort of breaking down for the cost, I think is an excellent idea as far as how we would sort of the students. I mean, it might even be better if one of the faculty, since you speak the language better than I do, you know, I could send out an email and copy someone, but it might be great for a faculty to, like you, Tina, or something, to email the students and say, hey, here's an opportunity. Here's what it looks like, and here's why you should do it.
You put it so well, Tina. I think, well, I hate to second that emotion, but I think you'd be great at talking to students and
thank you.
Understand.
I just really want them to say yes.
Me too. Remember, it's a win-win for me. Not only do the students get a wonderful opportunity, but those are 30 less students, and we don't know what we're 25, whatever it is. We don't know what it's gonna be like in the fall, right? I may have to come up with all kinds of alternatives.
That's what I'm guessing, Mary, is that finding sites for you guys this fall is going to be so hard.
Yeah, it is.
That will be a motivation, I think, for some of our APRN students.
Yeah.
Because they have to
That's why I think we'll have more,
right?
Who would be interested. Yeah, most of them are not in their clinical sites.
And Mary, do you think that, like, as we sort of develop the course objectives, or I mean, the course objectives are the same, obviously, but like as we sort of lay it out, that it would make sense to do it in a way that is sort of scalable, like,
yes,
you know, APRN students have like some little extra thing, but it's basically the same bones.
Yes.
Yeah. Okay.
And I think that it has the potential for the APRNs, because they want to come, some of them want to come earlier in the program. So if they did this earlier in the program, they might be motivated to actually do, you know, feet on the ground the next time.
Oh, what a great idea.
So
yeah, and the other thing about that, Sean, is if it's possible to show some of the nursing roles in the clinic for the APRN students, because
Okay.
Yeah.
and just really clarify that nurses really are the health system in Ghana,
Well, I
and
think
how
that
the
would be beneficial
clinic,
for the undergraduate.
especially the maternity ward, works. I think that'd be great.
Yeah, it's a good point, Val. And they're
Yeah.
going to want to see that for sure.
Yeah.
I think it would be great for the undergraduate students too, though, don't you? I mean, to be included in various nursing roles. I mean, I think they'll.
Yeah, but the undergraduate students, in my experience, are still in that phase of their development where they're trying to learn the rules of their own system. And so everything is a comparison, whereas the graduate students
Right.
have moved beyond the rules of their own system, and they're looking to break the rules and learn new things, and they understand how our system works, and so they've kind of moved beyond comparison, and they're a little more open to learning.
Well, and I always kind of go overboard, but I'm just thinking about the potential for the interprofessional aspect of it in the future, interprofessional collaboration with other healthcare, students,
Sure.
students, School of Health Professions,
Yeah.
to join and to all have the activities and interactions.
That's true, because are you speaking towards like the Ghanaian counterpart, the students who are in Ghana who are nursing students joining?
That would be great,
I
Sean.
wasn't, but that would be a good idea too.
Yeah, I think that's a great idea, Sean.
Yeah.
Yeah.
That's
It
definitely
really
something
is.
to look into.
Yeah.
That was one of the best parts of the trips that I went to Ghana for, was the students getting to meet the other nursing students and hearing how similar their complaints were. School's too expensive. These books don't make sense. The tests are unfair.
And that would, that's definitely something interesting to look into. So we'll talk to some of the schools, nursing schools, and see what their thoughts are about that. Just because that would be finally a way to have the kind of them having the same experience. That's kind of very.
Of course, you don't want to go on overload this first time, but whoever said the other schools, was that Val or Tina, but all of those allied health, all those trips are also canceled, right? So this might be something you could offer, not as a moneymaker, but to really support the communities. If we broaden the scope next time. I mean, I think this time we got enough to fight off.
Well, historically, that's how this trip started. Back when Linnell started going to Ghana, was she combined undergraduate nursing students with School of Health Professions students. So then those couple of trips I took, we had 25 students, but half of them were School of Health Professions and the other half were nursing. And that was a really good, rich experience for people from a variety of disciplines. We even recruited a few nursing students on those trips.
I think one of the things we're finding now too is a lot of students are already kind of sitting around twiddling their thumbs looking for things to do, in their basements. I imagine by the end of July, students, when it comes to global health, particularly with, these nurses might be really excited to be active and have something, a little more in their hands that they feel like they can, do to learn and also do to help and be out there. So.
I really like the focus that you have in your proposal, Sean, on COVID-19 also. And, obviously that's timely, but I think in terms of the community health class, that this is going to be spot on, and helping them to sort of think about the differences between basically a, upper income country versus a lower middle income country, and how that plays out. That we can build a whole lot into that for the class.
Yeah, I kind of like the idea of emphasizing how resourceful and resilient lower and middle income countries have to be for public health. and having the students take the perspective of, I'm doing this experience to learn about resourcefulness and resilience, much more than I like the idea that I'm going there to help. I think that's kind of a dangerous narrative, and I think we really don't want to emphasize that, because it's, I don't know, it just seems
Right.
false.
Yeah. I think that's something that we've worked very hard in this course over the last 5 years to get through to the students. Would you agree, Sean?
Absolutely.
Yeah, so I don't think we want our initial introductory email to emphasize that the cost will help the community, but rather the cost is for you to learn about the resourcefulness and resilience of lower and middle income countries, and that's what this costs. Does that make sense?
I'm not sure. I'll think on that. Thank you.
Maybe it's a combination of the value of the program.
It's the value of the program. It's not a helpful. We're not being helpful. We're paying what it costs to have this kind of learning opportunity.
What's your thought, Sean?
Yeah, I absolutely agree that it really should be more about the learning opportunity, because that it is, you know, something that they would not be able to have in any other way, especially without being able to travel. But I think that an additional benefit is that because we are working with partners in low resource communities, that a portion of the fees will support some of their activities. And when you're dealing with, you know, health directorates and centers that have literally like annual budgets of like $2,000, you know, to do outreach activities, getting a few $100s will go a long way to helping them be able to support, like, continue their ongoing initiatives. So it's not necessarily that they are helping in the sense of, no, the resources are already there. They already know what they're doing. They are resilient, but they are supporting the capacity to do a little bit more by being able to contribute a little bit to what they're already doing on the ground. And then having the course offers them the insight into what that looks like. So when they say, you know, when $500 is going, you know, to the Ghana Health, you know, Directorate to disperse to different clinics, they know that this is going to support a taxi to get nurses there. This is going to buy testing supplies. Like, they can really have a clearer understanding of how far those dollars will stretch in these communities.
I think that's good information to include, Sean. It's not that money doesn't make a difference. Money does make a difference. However, yeah.
So I think, I really like, you know, taking the emphasis off of helping, but partnering to increase capacity of organizations. You know, they're actually partnering with what's already going on, and they're active participants in, you know, supporting what's already going on the ground.
Yes, I like that. To me, that's a more accurate picture.
Absolutely.
And it shows the capacity and the, you know, the strength of the Ghanaian people.
Yes, absolutely. Okay, well, I think we've discussed a lot. I'm super excited to work with you guys. And so I guess our next steps will definitely be the top syllabus and lesson planning. How would we like to start those conversations? Maybe like having like a weekly Zoom meeting set up for now, where we kind of put our ideas together and then come together like once a week to see what it looks like. What are your thoughts?
That makes sense to me.
That makes sense. Okay.
Good idea.
Okay. Cool. All right. So,
is there anything you'd like to have us ready for our first meeting?
Me or
yeah.
Well, Well, I like working, I like that we're all going to work together. So I think for the first meeting, I would really like to see your syllabus already as it stands, to see what activities you have the students doing, so that we can better see like what we can embed to bring in the local context. So I think our first meeting could just really be matching activities,
Okay.
figuring out, okay, well, this is what they typically do. So what content do we need to curate to fulfill that objective?
Maybe Mary and I can put something like that together for the undergraduate students.
Yep,
Does that sound okay, Mary?
sounds great.
Okay.
I don't know, Tina, would you like me to request a Canvas site? One less administrative thing you have to do, but you can do it. Okay.
Yeah, no, I can do that.
Oh, you want me to do that, or are you gonna do that?
I can do it. Thank you, Mary.
And then Tina and I will work together to contact the students and find out, sort of where they're at with wanting to move forward with this as an opportunity.
That sounds great.
Yeah, would you copy us? I'd love to see the messaging that goes out, because I think it's good learning experience.
Yes, I will.
Absolutely.
It's all going into that article, Mary.
Yes, it is.
Awesome.
What
Okay.
Dom, did you say something? I heard you.
Oh, yeah. No, I was just saying on my end here, I will contact the local partners and inform them that I will be working this year.
Super.
Good.
Great.
Very, very important.
Yeah.
Not work without that.
Well,
Absolutely.
and my thought is that Will and I should probably get that email out pretty soon, because
Yeah.
we definitely want to know, what the student level of interest is before we get too far.
Yeah,
Yeah.
absolutely.
And I think it'll also ease their disappointment and anxiety, get something out soon, don't you?
I do.
But back to the one of the points Mary made, Sean, really come up with what your limit is.
Yeah. Have to think through. Yeah.
If there is one, I don't know, because
I'm just thinking like from, if we are, if most of the activities are happening on a project site like Canvas or something like that, there's really not a huge issue with the capacity. It really comes down to those Zoom dialogues and how to best facilitate those if you're going to have 40 people on a call. Are we going to, do breakout rooms, or, and if the internet goes down, are we going to switch to WhatsApp? So I think those are kind of the things that we can definitely embed within our planning. I don't know about you, but I feel like a Zoom call with more than 30 people is kind of
Insane.
May I?
Yeah, Dom, yeah.
Yeah, I think for that, I feel more comfortable waiting to see what the curriculum looks like. Okay. Because we may not be able to get everybody in the same room on the same time, but we could maybe have like 2-3 meetings a week.
Absolutely.
Are those breakout rooms? Well, I'm not an expert, don't get me wrong, but I'm learning. They've worked pretty good in my classes. So you could just start the lecture or discussion and then have them faculty go to a room to moderate and blah, blah, blah.
yeah, Sean, Mary and I have gotten experience with this COVID-19 pandemic of facilitating, classrooms of 70, 100 students and doing breakout sessions and all kinds of things. And so we can definitely work with you on that. And that's no problem.
So I have a question. Did every student that applied get accepted, or did you have so many students that you couldn't take them all?
We took them all.
We took them all. Yeah.
32, I think.
I know, it's amazing.
Yeah, that was like such an unprecedented number. I was like, are you,
Second biggest faculty-led program we would have run.
That needed an article, how you grew that program over the years. That was an article in and of itself. I mean, the best practices that you guys have figured out for that is, that's amazing.
I know. I remember we used to worry that we wouldn't have enough to make it let's
Tina
get.
brought a personality, and I think that helped.
I just want them to say yes.
You wouldn't take
No,
no.
I honestly think, Sean, that it is a testament to what an amazing program that you and Dom offer them, and the opportunities that they have had to have impact in the community and partner with, you know, local organizations and do meaningful work there. And they're talking amongst themselves. You know, it's the students that have been like, this is really great, I had a great experience, you need to go. So it's the program that you have developed, honestly.
Oh, well, couldn't do it without you and without all our partners. So we're just excited to have a new opportunity to engage our partners. And this is going to be something new for them as well. So this is exciting. Let's see how it goes.
Yeah.
Okay, so then I will send a general email out so that we can do our next meeting next week, I guess. So should I just shoot it out to Will, and Will will send it out to whoever wants to be involved? Like who should I communicate with?
I would say at this point, we just copy. Would everyone like to be copied on?
Sure.
Okay.
I don't want there to be a delay in me forwarding something or filtering anything. If everyone's okay, we'll just copy everyone.
Yeah, we have all our emails. I mean, I'm kind of new to the group.
Perfect. All right.
Sean, you know, I've always got to be difficult. The only day I can't meet is Friday.
No Fridays. Okay. Is this time good for people? The Thursday,
Yes.
10, 3?
Good. It's in between my 2 classes on Thursday, so it's good for me.
Okay. So awesome. So I think we can do the standing Thursday at 10 for now, and then if we don't need to do it every week, we can just kind of, talk it through if we feel like, okay, now we can do every other week or something like that. But at least for now, we can just do once a week to make sure that we're on track. Perfect.
Okay.
Perfect.
Okay. Thursdays at 10.
Thank you.
Thank you.